During the height of the pandemic, the federal government did something that was brilliant because they knew 78 million people, Americans across the country, got their healthcare benefits through a program called Medicaid that's designed for low-income patients to get free access to healthcare. And so what they did was pause the rule that required them to redetermine their eligibility to make sure that they could stay in the program so that they kept their coverage while the pandemic spread throughout the country. And that enabled people to get important COVID tests, important COVID vaccinations free of charge. And God forbid, if they actually ended up in the hospital, Medicaid program would pay for their bills and they wouldn't have to worry about any costs and they had peace of mind. And that period was called the public health emergency period. And that lasted from 2020 all the way through May of 2023. So for 3 years, any American that had this Medicaid benefit did not lose their coverage. They stayed enrolled and they stayed having access to high quality healthcare. And so the program grew. There's now 91 million people in America that get their health benefits through Medicaid. It's a beautiful thing. It grew by 16%. In places like New York, it actually grew by 38%. In fact, 1 in 4 New Yorkers call Medicaid their home for benefits. So this was a beautiful program. If you look at the Census Bureau data, 92% of America now has insurance. That's the highest rate it's ever been in the history of our country, even after President Barack Obama passed the Affordable Care Act, which means the pandemic is the reason why most Americans have insurance, and it's the biggest insurance rate we've ever had in our entire history of the country. And so there was a silver lining to the pandemic that some people don't talk about. But all good things do come to an end. The public health emergency ended in May of 2023. So that means that these 91 million people that have the benefit of this Medicaid program that gives them access to high quality care now have to redetermine and substantiate that they still can stay in the program. That means they have to show proof and evidence that they're still eligible for it. 91 million people across all of our 50 states. And so the biggest fear is that our most vulnerable Americans will be the ones that fall off of this program first. Who are those? Those are people of color. Those are people who do not get their insurance through their employer. Those are seniors, people who are over 65. Those are disabled Americans. Those are the ones most susceptible to losing their coverage. And why is that an issue? Because those are exactly the same populations that were impacted disproportionately by the pandemic. They had higher rates of COVID, higher rates of inpatient diseases, and it's also the same populations that suffer from healthcare disparities. What are disparities? Disparities are when certain populations succumb to diseases more than other populations. And so a perfect example is maternity mortality. Black women are 4 times more likely to die during childbirth than their female counterparts. That's a healthcare disparity. So imagine what happens if they also lose their insurance coverage, they lose their Medicaid coverage. We're actually going to exacerbate these disparities. And this is a catastrophe that's waiting to happen. But there's something we could do about it. We can share this information with others. Our friends, our family, our brothers, our sisters, our cousins, our aunts, our uncles, to get the word out, to make sure that people realize that now, more than ever, is so important for people who have Medicaid benefits, these 91 million Americans, that they have to act because the data is so stark. 62% don't even know that they have to do something to make sure that they keep this coverage, 62%. Reputable journals say that 18 million people will actually lose their coverage. And they won't lose it because they're not eligible for it. They'll lose it just because they missed the deadline. In fact, data shows that 74% of those that lose their coverage are actually still eligible for it They just didn't know how to renew it or how to keep it, which is a shame. So this is something that we can change if we do through word of mouth and get the word out and make sure that everyone knows about it. And the people that are most susceptible to losing this coverage, again, are our most vulnerable Americans, the ones where English is not their first language, the ones that might not be able to read above an 8th grade reading level. Those are the folks that need the benefits the most, and unfortunately, those are the ones that are most susceptible to lose it. So together, we can try to change this to make sure that America doesn't go backwards, and that our insured rates stay up, and that our most vulnerable Americans keep high access to quality care that they deserve. A year ago, I wrote a book called The Way Up, Climbing the Corporate Mountain as a Professional of Color. And I wrote it because in the upper echelons of corporate America, I didn't see people that looked like me. And so when I became chief operating officer of one of the largest health plans in New York, I decided to write that book as a roadmap and a guideline for others to come after me so that we can see more diversity, equity, and inclusion at the highest ranks in corporate America. And why is that important? To tackle these types of issues, because these types of issues impact diverse Americans. And so we need a diverse C-suite to answer the cause of what's happening in America to make sure that we solve these problems. And so when we see a C-suite that is as beautifully diverse as America, I think these types of big problems will be much easier to solve. Thank you.